Okay, folks, we're going to get started. I'm just going to reiterate that for folks who are in this call as an attendee, if you could keep your video off while we are recording, that would be great, just because this video is going to be posted for folks who weren't able to attend live today. So we're going to get into the presentation. Thank you for joining us today. We're going to be talking about domestic violence and mental health, how these things intersect, the effect on survivors, and how you can support folks. My name is Victor. I am joined by my colleague, Michelle. We are community educators with Family Violence Project, which is the domestic violence resource center serving Kennebec and Somerset Counties. Very happy to be with you today. We do want to make sure that folks know what we are talking about is difficult. People have all sorts of different interactions, experiences with domestic violence and mental illness. And so if at any point, you need to step away, to stand up, to turn away from the screen for a bit, whatever that is, during and after the presentation to take care of yourself, please do that. This information is important, but taking care of ourselves is equally, if not more important. So please do what you need to do. And we are going to get into it. So I want you to sort of just think about in your head, what you visualize, what words come up when I ask these questions. How do people view survivors of domestic abuse? How do people view people with mental illnesses or disorders? What stigmas exist? These questions are really at the core of what we're going to be addressing today. Everyone who has joined this call, if you're a medical professional or not, interacts with people on a day-to-day basis. And we all have preconceived notions that have been passed down to us by family members and society at large. When we think about survivors of domestic abuse, you may think about TV dramas you've seen or news reports, and there's a certain kind of character that people like to stereotype. The same with mental illness. The stigmas that you might name might be automatically being afraid of people with mental illnesses or disorders, or assuming they're not capable. And the same for survivors of domestic abuse. This notion that people are attracted to abusers or to that type of behavior or treatment, that it's something they want. All of this is false. We're going to talk about abuse and what it actually is, and how that behavior is a choice that is distinct from the behaviors of folks with mental illnesses and disorders, and also how survivors certainly can have mental illnesses and disorders, and supporting both of them as survivors and someone with an illness are not two things to be separated. So throughout this, if folks have questions that you want to throw in the chat, or if you would prefer to wait until after the recording is done to ask us privately, that is more than welcome as well. So we're going to define domestic abuse quickly before we move forward. Domestic abuse is a pattern of coercive controlling behavior, not isolated incidents of physical violence. It is in the context of a current or former relationship. It's when one person uses threatening, harmful, or harassing behavior designed to create fear in the victim. Purposeful and chosen, and it's based on a belief system that the abusive person has the right to limit the human and civil rights of the victim. We're highlighting this again because we really want to be clear that abuse is a choice. It is structured, it is systematic, it is purposeful. And so we do not want to conflate domestic abuse with these isolated incidents referenced in the first bullet point. And part of talking about what abuse is, and especially considering the diverse backgrounds and lived experiences we all have, we want to highlight the fact that in the hands of an abuser, anything is a weapon. And this is where we're really going to start talking about those intersections of domestic abuse and mental illness. Abusers both create and exploit vulnerabilities. Anything that will give them a leg up on maintaining power and control over the other person, they will use. So stigma and stereotypes are very powerful in controlling people's behaviors. The fear, shame, guilt that might come along with the assumptions that people make about others Disclosing that someone is mentally ill or has a mental disorder can be extremely hard when we have a society that largely assumes everyone is neurotypical, and that those who aren't, it is some moral failing on their behalf, when it's not. And then there's also the resource control. So if someone needs medication to help them with a side effect, something they're experiencing, not feeling like they can reach out to therapists or other medical professionals, keeping people in a place where they can't get the treatment or just the experiences they want. Using that mental illness as a weapon can look like a lot of things. And the examples we have, if you took your meds, this wouldn't have happened, going back to those stereotypes and stigmas and saying everyone will think you're crazy, no one is going to believe you. Or go ahead and call the police. I'll tell them about your medication or use. This is a presentation predominantly about mental illness, but we also want to reference, of course, substance use and addiction that might play into this. So, we'll talk a little bit about how to support survivors and folks that you're working with later on in the presentation, but we don't want to discount what is really scary to people, even if it's not necessarily scary to us. I am perfectly fine disclosing my history with mental illness and depression and how it's affected my life, but not everyone is, right? And so the things that I might express as being scary to me and disclosing those might not seem scary to you. But for the sake of the folks we're working with in our communities, we want to take that into account. Now, you might be asking about mental illness weaponized, for lack of a better really phrase, in the opposite direction. That's where we're going to talk about mental health is not an excuse for domestic abuse. People might make any number of excuses for their abusive partner's behavior, or people outside the relationship might make excuses, such as they wouldn't have done this if they were medicated, they're only abusive because they're bipolar or schizophrenic, or etc., which is so harmful to people who do have these mental illnesses, who are automatically labeled as bad people or abusers, when that's just not true. Or the abuser saying, I just had an episode, or doing that as a trigger for me, or something along those lines. Abuse is a choice. This is not isolated incidents. This is not lashing out. This is systematic chosen behavior that is keeping someone in a constant state of intimidation and fear in order to control their behaviors. So we absolutely do not want to have mental health or mental illness used as an excuse for why the survivor should have violence enacted on them, or why the abusive person should use that violence.
Okay, so we know that people who are experiencing abuse may have a lot of things going on. And I think sometimes, especially in the medical field and just in general, I think we think about survivors presenting with bruises or, injuries from abuse. But domestic violence can show up in many other ways when we're working with folks. And it could be, physical impacts from ongoing chronic stress, such as, migraines, GI issues, other things like that. Pain in the body, all those ways that chronic stress can affect the body, but also your mental and emotional health. So folks may come in with, symptoms of depression, of PTSD. They may be using substances where maybe they hadn't in the past, or using them more than they have in the past. They may come with, having had suicidality or suicide attempts, or sleep disturbances. So we know that these things, when people are experiencing abuse, these are ways that that can manifest in their lives. So we want to talk about these because, people aren't always quick to disclose domestic violence. There are a number of reasons for that. But and maybe, even the question that we use sometimes for screening, are you safe at home? Maybe they don't think anyone's going to hurt them, but they're being controlled in these different ways. Or, a lot of the time people don't identify abuse because they don't, they're like, this can't happen to me. Like, they folks are often, very kind about their partners and will make a lot of I don't know, justifications for, oh, they're just having a bad day, or oh, this just happened, they didn't mean it. And um, in one of the earlier sessions, we showed you the power and control wheel. And sometimes seeing that all together can be really powerful for folks. So being able to ask a few more questions, probe a little deeper, providing space for folks to be able to talk about what's going on in their life, or, what is your relationship like? What are things like at home? Can be great ways to open that door. Um, we also know when people are experiencing these symptoms, or maybe have developed anxiety, depression, PTSD, that can be then used by the abuser as well, saying, "See, you're crazy. I always told you. I always knew it. Now even your doctors say it." Even though we know these symptoms are manageable, people can live grateful lives, and it's not an excuse for abuse. But we know abusers will use that to abuse, and then use it to with systems. If someone is involved with DHHS, for example, the survivor may have these diagnoses and look like, they're experiencing a lot of things, and the abusers may have, this clean bill of health, but that abuser is creating the situation that's manifesting these different mental health conditions that someone may be experiencing. We also know discrimination and oppression increase these risks. So if the survivor is a person of color or a Native American, in a Q plus relationship, in ways that or in the Q plus community rather, if the society as a whole is causing oppression, that really increases the risk as well, and it increases the barriers to support all of those different pieces. Oh, and do you want to go to the next slide? So when we think about this, we as providers, as people in the community, we really want to push against those stigmas. Having this knowledge and awareness can really help us when we're working with folks or our neighbors, friends, to see why might something be going on, to step back and look at the bigger picture of what's happening here, and what are the things that are going on, and also to check our own biases. It's really important to think of how are we thinking about these things, and how is that coming across as well, because we know people who are experiencing abuse are often very hypervigilant, very good at reading people's faces, expressions, and that may allow them to disclose or allow them not to, because if they're feeling like this isn't a safe surviving abuse, all of those things can present in different ways.
Oh, I'm afraid that we might be losing Michelle here.
It's unstable. I'm hoping it's still working. Can you nod, Victor?
You're pretty choppy.
Oh, is it working here? Okay. Maybe, is it better now?
Yes.
Maybe, okay. Okay. Um,
Apologies, folks.
oh dear. So sorry, folks. Okay, so am I good? It looks like it's good. I can see things. So, we're doing this to, this is just scraping the surface, but hopefully it'll give you all some tools when working with folks, and being trauma informed with the work that you're doing. Do you want to go to the next slide, Victor? So one of the things that we often hear is people say, or the belief that I would never let anyone do that to me. And I want to say, when people are experiencing abuse, they're not letting their partner do anything. There are often ways that they're attempting to stop the abuse, trying to placate that abuser so that things won't happen, trying to get it better. I worked with someone who every day they tried to do it right so that their abuser wouldn't hurt them, and they're working really hard to try to keep themselves and their children safe. And there may be things that we don't know that are going on. We talked about the reasons why they don't just leave. Leaving in and of itself does not always create safety. So we know that people are often, attempting to stop the abuse, coping, resisting the violence in many different ways. We also know that, these attempts to manage the impact as well can manifest in ways that maybe don't look like safety to others, but have kept folks safe in that moment. So dissociating, during periods of abuse. And it's hard because this can cause adaptive things that don't work well outside of the relationship. So like if someone's in court, maybe that freeze is what happens and they dissociate in a courtroom situation that may not present as well. If they're working with DHHS, they might write them off as uncaring when that, their mind has left in order to protect their body. Um, they may use self-medication. Victor referenced substance use that we so often see, and that can be a way that someone's making it through the day. We see these things come up in many different ways when we're working with folks. And so to have that context to understand that people are often doing things to try to keep themselves and their children safe. You can go to the next slide. And then, so one of the diagnoses, that was mentioned was post-traumatic stress disorder. And I feel like that diagnosis title is so misleading because, even if the relationship is over, the trauma is so often not post. Even after a relationship ends, that abuser is often trying to do things to still control the survivor, especially when there's kids involved and they're still having to see them on a regular basis. There's so many times that there's still ongoing events and effects. And we may call someone paranoid. That might be your thought process when someone presents and is just looking over their shoulder and very jumpy and hypervigilant. You may say, oh, they seem really paranoid. And are they paranoid, or is that an appropriate response to ongoing danger that they're experiencing? We see this especially right after a relationship has ended, where, at least when they were with their partner, they knew where they were. Now that the relationship has ended, they are really concerned and aren't able to keep tabs on their partner in the same way that they had done for safety reasons. So that can be a really scary thing for folks. So being able to have perspective on what those symptoms are, and this person is working really hard to keep themselves safe, like we said. Their trauma reminders can come up in many ways, a smell, a song, a season. If abuse gets worse around the holidays because there's more time spent together, the whole Christmas season, hearing a certain Christmas carol, things can create trauma reminders. So, or things can trigger that trauma reminder. So like when you're working with someone, if they suddenly start, having a reaction to something, we like to think we're in control of our bodies, but we aren't always. That stress response might happen if someone walked by with like the same perfume or cologne as their ex or current partner. Things may happen that they aren't in control of. And so to be able to support people with taking breaths and, do you want to talk about what just happened? Like, I'm here to support you. Being non-judgmental is really important with this because people feel a lot of shame, especially when they may not know themselves fully what just happened. Trauma also affects the memory. We see this a lot. People who are working hard to survive the day, if they're trying to stay 10 steps ahead of their partner, maybe they've had a brain injury, maybe there are so many different things happening, they may miss appointments, they may not be able to do all the things, and they may then be disregarded as like not doing what they're supposed to when they are working really hard to hold it all together. But we know trauma and all of these things can affect memory. Same with like if someone's trying to recount the incidents. With brain injuries, the brain doesn't always make those memories if the hippocampus has been affected. So knowing that, it's not that they're not a good reporter of events, like their brain was not able to do that. So it's not them hiding something or trying to lie or anything like that. Like they just, their brain didn't store that memory. Or maybe it's hiding it to protect them. We don't know everything that's going on there. So being able to support them, how we can, is really huge. And then, the idea of like, are they overreacting or are they just trying to get through the day? That's such an important like reframing, because I think it's easy to judge someone or get mad at them. Like sometimes I hear, oh, they're in denial. Are they in denial or are they just trying to get through the day? Because they don't know what's going to happen if they disclose. Like that's really scary and can be a big can of worms that they don't know what's going to happen if they open it. So knowing that, people, I think we need to trust that people are doing the best they can and, just be present with them to support them in whatever way we can. And so a big part of that is that trauma-informed advocacy, understanding those trauma symptoms and how they impact, their ability to be in the world, and also understanding your own experiences and your own biases and, your own belief systems and the things that you do to keep yourself safe, but also how that reflects to folks around you. So we hope that folks get the support that they need to do this work because we know even, secondary trauma will have a session on it that affects us too, and that affects the folks that we serve. So being able to take care of yourself is really important. And then trauma informed advocacy, being able to create an environment that is safe and predictable is such a big part of this. So providing transparency, if you're writing something down, to be able to let them know what that is. Maybe someone needs to know like what kind of forms are going to be sent to their house because their abuser, might see those or intercept those. If you're touching someone's body, telling them what you're going to do before you do it so they know what's happening, and also giving choice. So if they don't want to be touched there, that is an option also. So supporting folks with choices is such a big thing, not just saying this is what's going to happen, saying, these are some options, what sounds best for you. We survivors don't often have a lot of choice in their relationships. So giving them choice in other places in life can feel really supportive as far as helping build back up their confidence and let them know that they are in control of their life and they do have a right to make choices about their body and about what happens to them. I'll pass it back over to you, Victor.
So when we are working with someone impacted by domestic violence, we are centering that person. So being patient, listening, and validating, you know, and especially being non-judgmental, checking our biases, and as we've said throughout this, understand that they're doing what they need to keep themselves safe. And part of that is also when we're asking, what supports do they need, trying to fill those gaps more than dictate, this is what I think that you need. So, for folks who work with individual patients or clients or all of us who try to help, the people we care about, we might certainly voice our concerns for someone's safety, but for survivors, like Rochelle said, it's so important that they be allowed to make the choices that they want to make, and the choices that they know will keep them safe because this is their experience. We aren't living their lives, and so people are really the experts of their own lives. That being said, you don't have to support people alone. If you're feeling unsure, if you need some help, if you need, to learn more or want more resources, certainly talk to your supervisor, certainly reach out to us. Our 24-hour helpline, which I'll talk about a little bit more in just a second, is there for survivors, but it's also there for providers as well. And take care of yourself. It has been a really hard last couple of years, and especially working with survivors. You might hear things that are really challenging or scary, and may bring up some reminders of things that you've been through, and that's true in so many situations. And so, carving out that time for yourself, being able to talk with a supervisor about the conversations you've had or the experience you've had, reaching out to us, whatever taking care of yourself looks like. As far as FVP goes, we have a number of services, and I won't go through the laundry list. But if someone is looking for support, if you're looking for support, survivors, friends, loved ones, caregivers, providers, our 24-hour helpline is there, and it's well and truly 24 hours. So even on holidays, there's someone there to answer calls. We do education pieces like this, so we'll be doing another webinar next month, and we invite you along for that. And if you want to learn about any more of these programs, they are on our website, and you can ask on the helpline about them. And you'll have this slideshow as well, so you can reference our long list or look at our social media. We are not the only DVRC. There are a number of members all under the main coalition to end domestic violence. We serve Kennebec and Somerset counties. If you're providing service to someone on one of those bordering communities, people aren't beholden to their one county. There are other folks that can help. And so, this map is a really great resource that we hand out a lot and can be found on the MCDV website. Um, as well as the Wabanaki Women's Coalition, which has a number of support centers throughout the state. Their map is also on there. And then finally, questions. So I'm going to stop sharing my screen in a moment, and the recording will stop so that people can ask questions that they might want to do so privately. If you don't have a question at this moment or would rather not ask it in front of folks, please reach out to Michelle or I. We have our work numbers there, so we can answer those when we have availability, and also our work emails. So please feel free to reach out if we can answer any questions, provide any more information, work with folks. So thank you so much.